Was a
Good.
$75 million building.
Project was before you got involved, right?
Yeah.
Got fit.
Texas.
Oh,
We're gonna go big.
Yeah,
hey, you guys are thinking way too small here. Come on.
with the tag on it and everything.
Yeah.
Right.
Yeah.
We're gonna be. No, we're gonna be locked in, circle of trust.
He's not gonna make any mistakes.
It's kinda
Like,
It's kind of like this, Beth. He's going. He's got you. He's just got a side bet on whether, do we have any second readings tonight?
Swear, nothing. EMS office, something, yeah. No, asking if they could use. You know.
Sorry.
Yeah.
And I'm, yeah, I don't care, you know.
Yeah.
How you doing?
Hadn't picked up yet.
Dropping it. Come
Oh,
I don't know if it's
no sense.
Come
Come on.
anymore.
Should keep the uncut versions like the director's cut. He'll just
I
say,
did
well,
start at
you guys can handle it. You know.
Portsmouth,
Yeah.
because of overseas phone calls for work.
Yeah, well, you know, it's
It's just that time of year.
So like
not the worst thing they would ever hear.
Oh, it does. It
Well, you
throws
please
you
come to one
off.
of our meetings.
That weekend. Well, it
Full
was.
menu.
Good. Good evening and welcome to the March 3rd study session. We are going to have a presentation by the Ellensburg Police Department regarding a couple of different programs.
Good evening, Council. Ken Wade, the Chief of Police. We're here tonight to talk about a couple of the community interest programs that we have created, stoled, and refined over the 2024 into 2025, and hopefully moving forward. And this is just a couple of several programs that have developed or in the process of developing. And all of it is being driven by our evidence-based policing model. Again, we recognize that we're not going to be able to arrest our way out of crime. We've been trying for hundreds of years and without success. So we have the ability that we ran in 2024 to see what the community's concerns were and hear from them. And then taking that information, it helped kind of built upon what we were seeing within the department is with regards to the juvenile crime, gang related. And when we dug into it further, when Ellie dug into it further, we learned that there was several things that needed to be addressed. And tonight we're here to talk about two of them. So with that, I will turn it over to Ellie to present.
Not sure I know. Probably, I'm not gonna assume. I appreciate that very much. I'll tell myself, don't forget to share. Yep, thank you very much. Again, thank you all for having me back to be able to talk about this. This is becoming near and dear to my heart when it comes to helping Ellensburg and the community. So to begin, just to give an overview of what I'll talk about, and feel free to ask questions as we go. I'm happy to answer them. But we're going to look at kind of where the community survey before very specifically directed us to the attention, looking at the two programs that we're working on, and then showing some of the numbers. I'm excited about the numbers. I hope you will be too. But also where it kind of leads to the next steps forward. So for our survey, if you could remember, there was some very specific elements, not just the quantitative that helped guide us to kind of the specific areas of focus, but it was the qualitative open-ended questions at the very end. They all opened up to very specific community interest areas. And those all being mental health, the community rapport building, focusing on homelessness, but most importantly, the child and youth concerns. This is something that this past year, not only magnified by the numbers, but also situations and circumstances. But this is, again, a survey that was done in January, and everything that happened after that post just kind of brought it to the heel of we need to do something more engaging. And so that's where the programs came. The specific areas that people were looking at was more of the gang recruitment, recognizing that even though the incident that happened on Main and University did bring all attention to the situation of gangs, the survey itself and the participants were recognizing and saying that we need to acknowledge the fact that there are gangs in Ellensburg and how they're being recruited and how it's impacting the children. Looking at exploitation through the internet, trying to find ways to mitigate that, cyberbullying and mental health concerns, which kind of bleeds out to all other areas, and then drug abuse. So it's looking very specifically at what is affecting our children. And that's where being able to understand what programs can help. And that's where we came across the Handle with Care. And just out of curiosity, have any of you heard of this program before? So there's, all right, I'm getting some yeses and nos. By the end of this, you'll be totally familiar and very confident in it. So Handle with Care is something that is nationwide. It started off as a possibility where parents, if they saw any types of concerns with their child or experiences that happen at home, they can send a message to the school, Handle with Care. No explanation necessary, but it let the school know that there was a situation that might cause the child to act differently or need a little bit more support and encouragement in the classroom. This blossomed into something a bit more. And so what we have is a little bit greater than that. Just take that, all best practices, and we made it better. So looking at the reasons for this, the numbers. Now, when we looked at juvenile arrests over the circumstance of 2024, this is all the way from January through August. There were 4 dominating reasons why individuals were being arrested that were juveniles. So these specific areas are all indicative of gang activity. They're associated and affiliated with it. So this is something that's found in science elsewhere outside of Ellensburg. And we were reflecting that even in our numbers. So it's recognizing that it's not just the concerns of the community, not just what we're seeing within the police department, but crime itself of what is happening is actually indicative of something that we need to look more into.
Can you
Sure.
explain those?
Okay.
What are the 4?
Not a problem. So the highlighted ones, you have alcohol-related crimes with juveniles is the first one. You have assault, you have harassment, and then malicious mischief. One of the other indicators is theft, but that didn't project onto the top 4. So having 4 out of the 5 indicators is something that all other analysts know to look at. And that's something where being able to look more specifically at gang activity. Now, the reason why this is important to understand for juvenile crime is that most gangs with their recruitment are fostered and they survive based off of juvenile recruitment. Most individuals that are a part of gangs do age out in their mid-20s to 30s. Some do continue on longer. Those are very specific skewed cases, but most individuals, they start in their young teens and they go on till their mid-20s until life circumstances changes otherwise. It changes the path. So, yes.
I had a question on the numbers. Are these, I see they're different charges, but do these represent individuals or or do you have situations where one individual may check several of these boxes? So the numbers might not indicate total numbers of people.
Not total number of
Okay,
people, just
okay.
the arrests.
Got it. Okay, thank you.
Those numbers are elsewhere, but we do see there's not as many multiple just based off because this is just January through August. But it's enough that even though these aren't exceptionally high numbers, gratefully so, it's still something that it pinged on my books as significant. Hopefully that explained.
Yes, thank you.
So this is where looking at, so what are some of those contributing factors even further? So like the chief said, we can't arrest crime out of the community, but it's looking at what generates and what bleeds over into those decisions to make, to partake or participate in criminal activity. And that's where the adverse childhood experience is, often known as an ACE. These are situations of high duress, high stress, and potential trauma that a child experiences. And all of those, when a child is trying to process and work through those situations, it interferes with their ability to stay focused at school, engage in healthy relationships. Oftentimes it's circumstances that build up to an ACE that bleed over and interfere with just regular childhood. And being able to see the impact this has. Not only does it definitely perpetuate into greater concerns for that child as they begin to progress in life, where they make more decisions that are kind of leaning more towards criminal, but it's also creates that kind of a habit or behaviors that they follow down. So one of the things that we looked at is what is something that we can do as a police department to mitigate this. And even though when it comes to mental health, we have professionals that do that, we recognize that we definitely have a role and a responsibility to be able to help children. What does it mean to the community? Well, first of all, it's the children, supporting them and encouraging them, every single one, to know that they have a community that rallies around them, even in times of crisis. But the cost that it happens to that, you could see on the image on the right side, where it is quite considerable. Now, looking at the program Handle with Care, when it comes to the amount of cost for that program, which so far has been zero, no cost at all, other than just our time, is like what it's going to save the community, saves the children, but also in that extension. So those resources can be reallocated elsewhere. So looking at this for Handle with Care, how this came apart was looking just south of us in Yakima. They have a Handle with Care program that is taking what is seen nationally and amplified just a bit more. They focused on the start of domestic violence and individuals who have that interaction and contact with the police. They report that and it's just a reporting process. It doesn't initiate anything. But what we recognized here in Ellensburg is, as far as the group of partnerships that we have, is that we can go a little bit more. And so what we've done here is not just domestic violence, not just individual circumstances, but it's all contacts where a child is involved. And sometimes in extension, if we are familiar with the circumstances of the family, even the child is not reported on the case itself, but individuals within their family, that's where they get an automatic notification to the school. This is compiled daily, and it's based off of just a simple code that our officers put into our system. On a daily basis, I'll go into it as the analyst, and I have a great partner who's going to be coming on board this next week in our records department. So we'll team together and we compile a report of just the basic information of the child's name and demographic information. So that way we know which child and which school they go to, and the circumstances to the security officer is just the nature of the contact, no involvement. Something that we do different from Yakima is that we also include all children. So not just witnesses, not just participants, not just individuals mentioned, which is what Yakima does. We also include arrestees and suspects. And so it's individuals who are the ones that are suspected of a crime, they're included where they were excluded before. Then going a little bit further than just that is not just notifying the school, but we also send an automatic referral to the brand new CWU Community Clinic. Michelle and her team there are open arms and welcoming. They get referrals for all children 12 to 17, and the guardian information of the children is provided. Again, no specifics of circumstances is given beyond that. So it's not trying to point the finger at the actual circumstance or the child's involvement, but just looking at this is a child who needs help. That is what initiates the process where EPD takes a step back. Michelle and her team steps in. They contact the guardian or the parent and offer no-cost mental health support. And that's where being able to look at that extension, us as EPD, we're not the ones doing the provision, but we're putting individuals in referral process. So they're able to get help where otherwise before they may not have been able to get that. Any questions on that? It's convoluted, but I promise you, it does help. There is a handout in front of you that outlines it even more specifically. But it looks at just the process of how do we get a child recognized within the school so they can have a handle with care, but also get them support externally from the school. So the great thing about it is Michelle's team doesn't just receive referrals from EPD. She also receives referrals from the schools, and we've also partnered with juvenile probation. And so it is possible that one individual person can get a referral from 3 different entities. And so the guardian and parent might be getting 3 different phone calls. But the idea is just to reinstate that their child is significant enough to warrant the need for help if they're willing to accept it. And sometimes just knowing that that safety net is out there is enough to be able to help the parent and the child to be able to process. So it doesn't it's not necessary, but it is important to recognize that some children do need that help.
I had one quick question on the ACEs. I was familiar with it from a number of years ago. I was with the Community Network Coalition and they did training on that. And I remember the strong correlation. The more many kids have multiple, which significantly increases the risk. I was just curious, as far as the input, how do you determine, who determines that an individual child has one or more of these ACE factors? Is that fed through another system, or is it part of what you do?
It's part of what I do, but the great thing about it is I don't determine whether or not they've hit a certain number. We've decided as a partnership collaboration that just one is enough. So it's recognizing that when they have contact and a law enforcement officer is involved, maybe the first time, might not be. So that's where we saw it necessary to provide that referral. So it's not a diagnostic, not an assessment. It's just that automatic extension.
Great, thank you.
No problem. Yes.
A question, are there any privacy issues with this, concerns? Like, well, I could see a parent who gets angry because you're messing with their kid, you know. I don't know. Am I thinking crazy?
Absolutely not. And that's something that we took into consideration. And that's why the child themselves are not contacted. It's the parent guardian that contact is given. No contact information for the child specifically is given, but it's one of those that extension, they can receive a referral from many different means through the community clinic, like I said, through the school and other places. I know that Michelle's working with all school districts. And so it is an extension beyond just police. When it comes to that contact, and we do have some circumstances where a young child has had contact and the parent did not know about it. So the first time they found out about it was they got a phone call saying, you've been referred and this is offered. Well, that's where being able to put the information out there of what the circumstances are in extension. The great thing about it is Michelle and her team are very practiced when it comes to the referral process, because her experiences from working down in Yakima is to be able to help the parents understand that there is nothing beyond just a name that's been provided to them. So when it comes to very specifically, as soon as the referral is given to Michelle, that's where my role stops. I don't find out that one child I don't follow them through the process. The only thing that I'm linked in with is total numbers of, okay, this is the total number of children that are coming into the clinic. I'll never know if it was EPD specific, juvenile probation, or through the schools. And the one thing that I'm grateful for is just that those children are getting help. So that's where we just start that process. We have the numbers that you saw previously and some other methods to be able to see, is there a significant change? We don't have to have that information. So we make sure very clearly there's no HIPAA violation and there is no support. When it comes to this case information, because it is juvenile related, we're very cautious of who's wrapped into that and who's grouped in. So far, it's just the school security officer who otherwise would already be involved, the school resource officer, because being part of PD and to know that if there's a circumstance where a child might need just an additional contact. And this is a practice that Adams Elementary School in Yakima started. And I want to give accolades to them. They went beyond just notifying the teachers. They notify the staff, they notify the nurse, the counselor, everybody, and they go out of their way to have a positive contact with the child, whether it's just being able to say a smile or say, I'm glad you're here today, just to be able to have that positive contact to make a difference. The child themselves are not labeled, and the very strictly rules are placed within the schools that they are not to press for information. They're not part of the investigation. The officers are not going to reach out to them for more information as an extension. They are not an acting agent of the EPD. They're just to take care of the child as they were before. So we're making sure that there are strict rules and lines that are not breached to be able to maintain that privacy for the parents and for the child.
Great. Thank you.
Oh, go ahead.
Just Michelle is with the clinic or,
Yes.
okay.
She is a licensed practitioner when it comes to being able to provide support. She has quite the phenomenal reputation for what she's been able to do down in Yakima, and to have that resource here in Ellensburg is what truly has made this all the more successful. She's helped guide me on the process of what information to share, what to provide, and where to draw that line. It's a very close collaboration.
Just want to make sure I wasn't missing something.
No problem.
I was just curious. I was wondering if you're familiar with CASA, obviously, and what the program they have, which is amazing, advocating for kids that are in bad situations.
Mhm.
Is there any intersection or integration with the CASA group of kids, which are unique in the system, obviously, and Handle with Care?
I'll say, I hope so, that there will be very soon. Right
Okay.
now, because this is just in the infancy. We just started this November, the beginning of November. Technically, thanks to the chief recognizing that there was a situation, it bled a little bit into October. But it's what we're looking at right now, and a sneak peek to the way forward is just that, is finding out more partners and more groups that we can bring into the inner fold to make sure that we have a fully fledged support network for these circumstances.
That sounds great. I know CASA's been doing amazing work,
Mhm.
which seems sometimes to be all by themselves. I know that's not the case, but they've been out there for a long time. So it's great to hear.
I've worked with them elsewhere, and I'm delighted to be able to have the opportunity to work with them again. So what has happened so far? So the total number right now, as of this morning, is 193. And so the February one is updated to actually 53 children for the month. And something that is very important to recognize is when we look at numbers, it's very easy to lose track that each one of those is a child. Each one of those is an ACE. Each one of those could represent more than just one circumstance for a single child. We do have several that have had multiple ACEs just in this time frame. So it's being able to recognize that and track that. That's where not just looking at Handle with Care, but what other programs can we bring into the inner fold to be able to, again, help mitigate those concerns for those who start to see on a repeat element. So the way forward specifically for this is the extension throughout Kittitas County. I had the delight to present at Cle Elum and Roslyn last week, and they were very open and welcoming to the concept of extending beyond there. So we'll be working with that, working and integrating even further within the school district, and with working with the school board to recognize if they see anything or any ways that we can extend this program and grow it all the more to provide the support. Being able to identify even more so partners, like we mentioned before, CASA is definitely one of them, but also looking at other first responders. This isn't just a police thing. Even if an EMT responds to a house, that might be a circumstance that warrants a Handle with Care. So trying to look at what does that look like for them to be able to extend that to them. And then just looking at other opportunities, alterations, and modifications we need to do to the program. It's very much flexible right now, but we do have something that obviously we can point out has made a difference. And based off of the quarterly report from Michelle's team, 13 children have gotten help that they otherwise would not have. And I can't say that's through EPD specifically, but I like to think that we had a role to play in part of that. The graffiti abatement program. So taking a little bit of extension to something else. This is the second program to present tonight. This is recognizing a situation that actually it started with just being able to, from my familiarity of Ellensburg, And walking through some of the alleyway, not only is there some phenomenal art, but unfortunately there is a problem when it does come to graffiti, and especially within our parks. And so our Parks and Recreation Department have done a phenomenal job of maintaining, cleaning up what they've seen, but we're recognizing that there are some other areas where they needed additional support for our community members that have been victimized by graffiti. So to explain a little bit, because this is something I had to go through the education of, is the difference between street art and graffiti. So street art is the colorful, very much dynamic. It is a new wave of art, not so necessarily new wave. It's referred to oftentimes as graffiti, but this is more specifically aerosol graffiti is another term for it. But this is what you would see if you visit the north side of Gerald's. They have phenomenal artists. What's important about this to recognize is that taggers respect the art. Oftentimes, they will not paint over the art. So this is something that we've worked with. And I know working with Kelly is going to be an opportunity even more so as the weather warms up, is what we can do with this. What I'm talking about, the concern is the graffiti that when you look at it, you can recognize this is not art. This is more of just territorialism, marking, just circumstance, have a message to say, oftentimes derogatory, but more than not, it's gang affiliated. And so this is something being able to see there are property owners, whether it's businesses or private property, they have graffiti and they need assistance to be able to remove that. Most of the time, the cost is consumed by the individual who's been victimized. And it's very difficult to be able to follow up with malicious mischief, especially if we don't have cameras, we don't have photos. All we know is we have it happen. We have a tracking system to be able to monitor the graffiti. And I do the analysis of the individual ones, but it's one of those to get to the point of what do we do to help clean up the community? And that's where the idea of the graffiti abatement program came through. This is a collaboration, I'm very proud to say, with the Ellensburg Morning Rotary Club. They stepped up and stepped in to be able to help out. I had the opportunity to present to them about this whole program and the difference of graffiti and the problems that we have because of the gang affiliation with it. It is a problem because not only is it an eyesore for the community, it is also a safety concern as well. Oftentimes gang members will use it not just to mark their territory, but also to send out a message. And the message may not be to the community. It may be to either a rival gang, individuals within their gang, or just a message out into the abyss itself. But the reality is that this is not appropriate for a community. And so we need to do something about it. What this is as soon as an individual reports to us that there has been graffiti, our officers do take a report. And what we'll be working through is we'll be able to extend to them the offer that if they need help to be able to remove the graffiti, that we can do that. And that's where a referral would be given to the Rotary Club, and they would be able to facilitate and organize a team to be able to put together. What it would be is that contact information for one specific person from the club will be given. And oftentimes, if an individual asks for help, we'll help facilitate it as far as EPD. But beyond that, it would be up to the volunteers themselves to work out a time and circumstance would it be. I'm working with the possibility of being able to acquire free paint as much as possible. I have a stockpile so far, but this is something through Ace Hardware. Their distribution center has been able to help out. So not only is this no cost to the property owner, but also mitigating the cost that it would be to the Rotary Club as well. We're in the process of developing the MOU. I'm proud to say that it is on my desk right now with recommended changes, and I'm working through those right now. So I hope to have that to the chief tomorrow, and I'm sure he'll make sure that I do that as soon as possible. Any questions on that so far?
I get,
Okay. So what does this mean? Now, these are numbers, but I'm going to tell you this. Don't worry about the numbers. Worry about the colors. And if you have a hard time seeing the colors, I'll explain it a little bit more. What you can see is that there are some individual different types of crimes. And this is from my monthly status report that I provide the chief. This is a behind the scenes look at it. So knowing that this is a study session, I wanted to show you what was raw and what I see. So I can help show you what, whenever I have one of those, either a red flag or a green flag showing up, I'm going to show you a red flag of something where it's like of concern and then an amazing green flag of something that's happened. And so you'll see, starting in February, all the way through July, we have some points where you see yellow and red. And this is a kind of a hyper influence of heightened increased juvenile crime in comparison last year. Now, for those statisticians out there, I know all of you deep down inside very much want to be, these are Z-scores. So it's looking at a comparison to 2023. This is 2024 information. So anywhere that shows yellow is kind of that moderate, keep vigilance, and red says we need an intervention. We started the collaboration for juvenile crime prevention, and I was tasked with that by the chief. He gave that to me in June. We had our first meetings, and then we initiated where it was more hyper-focused on juvenile crime prevention in August. And if you look at what has happened since then, that bubble's gone away. So those initial red, yellow that you see is the red flags, but the lack thereof, where almost like there's an immediate wall, that's the green flag. We're doing something right, and it's having an impact. So these are things that I watch and observe on a regular basis. So this is where the numbers, even though I would love to think that Handle with Care is absolutely the best answer, I let the numbers speak for themselves. And that's where the science comes in, where I can't influence that. I can't dictate that. All I do is pull that, and it automatically will generate the colors for me. And this is what I see. So this is the evidence-based practice necessary to determine what programs are most efficient to be able to help our community.
Can you tell us a little bit about that collaboration? Who does it involve?
Absolutely. So it has grown immensely. It starts with us here in Ellensburg, but we also have the sheriff's offices involved. Cle Elum, Roslyn is involved, Kittitas is involved, CWU Police Department is involved, and this is their chiefs. We also have juvenile probation, the prosecution's office. I brought in ESD 105 for the schools. They have their SOC team for the security offices. We have representation from the schools and for their security officer as well. Our school resource officers have been brought in. And anytime I see the possibility of more of those like CASA is where they'll be sent an invitation. Boys and Girls Club was invited to come into our last one because I know that they are looking at more integration into Ellensburg proper. They're in the county, but we recognize that not just acknowledging the juvenile crime prevention, but we also need to give our kids something to do. So what can we do as that collaboration focus be able to support other entities before the crime happens? So, and I know Boys and Girls Club has some phenomenal programs that come in. The extension of that, I'm looking at some other agencies that are nonprofits, specifically looking at gang intervention, where we bring in individuals who understand, who know the lifestyle. I personally can't speak to it because that wasn't the walk that I walked, but bringing individuals who have found a way to off-ramp that lifestyle to be able to come in and help those who are engaged right now. So those are the possibility, and then any other extensions. So I'm definitely promise you this, any suggestions you all have, I will be following up with those as far as that expansion. But it has been, everybody comes to the table, they have their recommendations, but most of all, they have a willingness to everybody works together. And that's where Handle with Care came from. So the way forward is our mural project. I'm not going to say too much about that because I'm really excited about, but that is something to come. We have what's called an empathy panel, a project that I'm working with juvenile probation, and that is actually just been scheduled. I locked that in today. That'll be later this month. This is where we have individuals, juveniles who have entered into the juvenile probation system, into that being able to sit and tell their story. And we'll have some officers there as well to be able to share their perspectives. And the hopes of this is to be able to have that shared understanding and be able to see from different dynamics of what it's like when they have that encounter and the potential of fostering more empathy, thus the name. We have community education presentations that are going to be scheduled. An example is one that is definitely recognized and asked for not, and this is a sneak peek for the 2025 survey. There has been a high demand to understand more about gangs. And so we are scheduling that as an open opportunity for anybody in the public to come learn and the basic overview. There's been many community organizations, even the library themselves, that have asked our team to come out and talk about gangs. And so they can have a better understanding. So we're just going to continue that. And if there's anybody who wants that, all they have to do is ask, and we'll figure out a way to make sure. That's the reason why Rotary Club was able to step in and help out with that. They were able to have the presentation and then took it a step further. And then it's also school education presentations. This is not for us to do without the children. We have to integrate them. We have to have ownership from them. But best of all, they have the greatest ideas. They know what engages them. They know what understands them. But we also need to help them understand what the threats out there are and that they do have a community that supports them. They may not see it outright, but we have a responsibility to ensure that they see it more openly. And so that's what these presentations are. So these are the angles that we'll be working over the next couple months to grow even more so. Yes, sir.
Dr. Carr, thank you for this wonderful information. For the citizens at large, is there anything that they can do to support you either in the ACEs kind of with CARE or with the graffiti abatement program?
I'll make it even more specific. The one thing that community members can do is to recognize the children that are around them and take time and engage with them. That's the number one thing that helps these programs the most because we won't reach all of them, but the community is wide enough and large enough that they can. Now, the program specifically, we're going to be pushing the information that you have in front of you regarding Handle with Care, so more people know about it. People are less likely to be caught off guard. We're going to be pushing that through social media, and hopefully more information will be provided even on our website for that. So it's just getting the word out, letting them know that if they do get that call from the clinic, it's not a bad thing. It's actually a good thing. And it just means acknowledging that here's a circumstance where you can get the life skills necessary to process better. When it comes to graffiti abatement, I dare say, report the graffiti. Even if it's been reported before, it's important for us to know what has been mitigated, what has been taken care of, so we can go out there and we can recognize that. So it's just open communication. We have our non-emergency line where people can call in, they can ask questions, and definitely my contact information is out there if anybody has any questions. But the other thing that I can say is their ideas. They know what works in this community, and I'm willing to listen to all of them. And I'm sure the chief is willing to help me select very individually, not all of them. I would want to, but what we could move forward with. But we definitely, as I can see, Ellensburg actions, we don't just talk, we do. And these programs here show that. So I hope that the community sees value in sharing their information because they could be a part of the solution to this whole challenge that we have.
Thank you, Dr. Carr.
Great. As always, if there are any further questions, that contact's there. Sir?
As I mentioned before, this is just one of several programs we're looking at and finding ways to make our community not only safer, but healthier. And this is currently it's driven by law enforcement. But that's not what our hopes are. Our hopes are is that we would be the catalyst that would stand this up. We would get all the partners in. Everybody would have a good working relationship and a good understanding of the direction that we're going. As all of you sit on other boards and deal with other issues in the community, oftentimes what we find is there's great groups within the community. But the challenge comes in getting those groups together and getting those groups working towards a single goal. And so when we put this program together, it was done with the focus of being able to plug in any other organizations to it. With the contact with the schools, once the sheriff's department gets up and operational, then the schools will be ready to receive the information. So we're working closely to help these other entities get up to speed on it. Not as fast as we've done it, but we also account for the largest portion of crime and juvenile related matters in the county. So that's why we thought it was so important. And what Dr. Carr had mentioned, the very first ones that we had in October was I responded to assist my patrol officers with a mental health call. A female had said that she was going to kill her husband and then commit suicide. So we contacted her up off of Water and Helena. And during that contact, I freed up one of the officers to go talk to the husband, find out what actually took place. When we came back, we found out that there were 2 small children in the house. These children got to watch the mother say that she was going to kill her husband. And they got to watch her pick up a knife and walk out saying she was going to kill herself. And so that's why the very first 2 were my 2. It's our hope to overcome the challenges that we're having in our community. But there's a way forward, and that's what we're going to focus on. So our next batch of tasks that we're taking on is going to broaden several programs, but the bringing in comprehensive, bringing in CASA, bringing in some of these other organizations, I think is the right direction for it. But it's also not a police function. We will help anybody else, but it will have to become somebody else's overall program. But we will always be there to keep it moving forward. Do you have any questions of me? Yes.
Chief Wade, to that end of being able for the community to kind of take a hold of this program, do you have kind of a timeline in which you would ideally target that to occur?
Absolutely. I was hoping for November 1st. But no, there's going to be a large training component that goes along with it. And then plus we're constantly learning new things about it. As Dr. Carr mentioned, the outreach to KBFR and some of the others, emergency services, coming up with tools to where they can notify us about these. We're also looking at, not only the involvement of the counselors for the kids, but what should be mentioned here is that Michelle and the Boys and Girls Clubs, they also offer counseling for children and families. And so when we had discussions with the school district about what was the challenge that they were seeing at the schools, it had a lot to do with the inability or the lack of resources that parents and single parents had. And so we were hoping to use this as a tool to help educate those individuals and provide them the needed support that they need.
We've heard a lot about the mental health practitioner shortages in this county, and citizens taxed themselves to try and address that. So are you finding that there are enough
That's what pays Michelle's salary.
counselors?
we-
Okay.
The system that they're gracious enough with the university to put the money up front, and correct me if I'm off on this, but was able to stand up this counseling center. And then the university is also utilizing that resource in the education of other students in that same field. And so the 1/10 of 1% money is a huge piece of this and has been very beneficial. But yes, we still have shortages. You said we're close to 200 handled with cares. 13 of them are getting help. If 200 of them are getting help, then they wouldn't have the resources for it. So there's still that need.
And they're not getting help because the parent or guardian didn't take you up on the offer.
Correct. And that's one of the things that we're going to focus on, more of the community outreach. Because if you're just getting a call out of the blue from maybe we're hoping to be able to strengthen that message by letting people know that, and letting our community know that handled with care is not a bad thing. It's a great thing. But again, the reason that it's not a cop thing is to help that too.
If I remember my ACEs training right, there's a ratio. If you have one bad experience, you need 5 good experiences to overcome it. Is that
I would turn that over to Dr. Carr to answer.
something like that?
It all depends on the circumstances.
Yeah.
And oftentimes they say it takes 7 to
Okay.
reverse a one, but the thing that I've been able to see in all my time of working with children is that sometimes one can be enough, and that being able to have that influx of one community member who represents an entire community can be what magnifies that all the more. But the thing that I kind of want to emphasize the most is when it comes to the treatment versus care, the counseling support provides tools. Now, we all have basic tools in our toolbox, but not always are those the tools necessary to fix a problem. And oftentimes we need to go find those resources. What people oftentimes is to admit that you're broken is part of that. And that's not it. It's these children aren't broken. These families are broken. They're just going through tough circumstances, but having the tools necessary to come forward. What the school psychology program at CWU, those graduate students, they're in the practitioner. They each are assigned one individual child. So they have the capacity for more, thanks to Michelle, because she also provides that support. But just that one time. And what I've been able to see too is just the phone call itself. This is something that before hasn't happened. You have a difficult time, please get involved, but then you have a follow-up phone call of how can we help? That itself can magnify enough. So you don't necessarily have to go in for the treatment to have that kind of like emphasized or echo through the situation, but it's all about helping to process that. But it's the 7-to-1 is the ratio I think you were looking for. Thank you.
Any other questions regarding these programs that we could answer?
Thank you.
Thank you.
Kudos.
Okay.
Kudos.
We're going to break until 1900 hours and we'll begin the regular council meeting.